We're glad that you're coming to visit us here at the Medical Center Clinic. And if you were referred by an outside optometrist or ophthalmologist, we're happy to have you here. I'm Dr. Tim McLaughlin, and I co-manage patients with many local optometrists as well as other ophthalmologists. Here at the Medical Center Clinic, we're located right next to West Florida Hospital, and my office is right next to the pond in front of our two-story building, and we have a surgery center right here in our building. My office is on the second floor. The ophthalmology department's on the second floor. If you're being sent to us for a cataract consultation, welcome. We're glad you're coming again, and we just want you to know what to expect when you come visit us. The first thing to know is that you've got to plan to be here for approximately 2 hours to get everything done. We want you to possibly bring a friend or a family member with you who can help you remember all that we talk about and even think of good questions. In order to prepare yourself for the visit, we want you to avoid wearing contact lenses for 2 weeks prior to coming to see us, which I know is sometimes difficult. Hopefully you have a pair of backup glasses you can wear while you're going without the contact lenses. Because we need to get very precise measurements of your eyes, we don't want any dry spots on the eye. We don't want dry spots on the cornea. We don't want irritation. So we want you to perform lid hygiene, where you scrub the eyelashes every evening using a product like OcuSoft. We want you to do that every night for 2 weeks if possible, leading up to your visit with us. We also want you to use artificial tears, 1 drop in each eye, 4 times a day, spaced out during the day. And that'll help make sure that the surface of the eye is lubricated and we don't have any dry spots that would interfere with our measurements. When you come to see us for a cataract consultation, you need to be prepared to be here for at least 2 hours, and you will be dilated. It's very important to dilate your eyes in order to get an adequate view of the cataract and in order to see into the back of the eye. We want you to prepare your eyes for this visit by using the lubricating drops, doing the lid hygiene that we talked about, because the measurements of the eye are so precise and so critical, and they affect the implant power that we might choose to use when we do your cataract surgery. One of the tests that's very important is a measurement of the surface of the eye, the cornea. And the cornea, if it's shaped a little bit oval like a football instead of perfectly round or spherical, that causes what's called astigmatism. And astigmatism makes your vision blurry. So we often want to correct that at the time of surgery. And we get a topographic map of the cornea, which we print out and look at. And we also measure the astigmatism in several other ways with other machines to make sure the measurements are consistent. As people often say in the construction industry, measure twice and cut once. And that's our philosophy here as well. We want the measurements to be absolutely precise. If we can get them at your first visit, that's great. Sometimes, if we find dry spots on the cornea, irritation, we might have to treat that and have you come back and repeat those measurements to make sure everything's consistent. One of the other measurements that we get is of the back of the eye. So we actually, once you're dilated, or even before you're dilated, we can do a scan where we shine a light into the back of the eye, and it gives us a measurement of the retina. And it gives us a very precise view of the retina because we want to know if there are any diseases of the retina that might limit your visual improvement after the cataract surgery. And then the other test that's critical before cataract surgery is to measure the size of the eye, the thickness of the cataract, the size of the cornea. All these measurements we put into mathematical formulas that will then predict what power implant will give you the focus that you want after surgery. So some patients want to see at distance after surgery. Well, we've got to calculate then what power implant would give you the best distance focus.